Hello everyone, this is the recording of the second Arabian Summit on Complementary and Alternative Medicine conference from Dubai. And the presentation is about beyond receptors, hydration shells, pain oscillators and tissue responsiveness. We are a hybrid pain clinic using both Western and traditional medical methods, as well as photobiomodulation laser with AI support, both in telemedicine as well as in physical clinical environments. The concept is to mitigate the side effects of Western medications and improve their effectiveness on the long term. The concept is based on Pollack's, Judica and other reputable scientists such as St. George's water hydration cells concepts. The point here is that hydration shells around phospholipid membranes, DNA, collagen and microtubules may form, and plants and laser may interact with that hydration shell. We did artificial intelligence-based analysis of plant molecules, and it revealed that they might act on the water shell and this structured water grid in living biological systems. The Judica's coherence domains essentially says that there are tiny little microbubbles forming in water. In the center lumen there are quasi-free protons trapping oscillatory signals, and on the wall there are structured water layers with vortices circling around. Pain and rigidity and fascia tension may come from discontinuity or coherence loss of this hydration shell around biological structures caused by trauma, membrane rigidity, dehydration and metabolic waste that may disrupt the coherent signals in this network and living system. We postulate that beside Western medications, these plant-based natural chemical agents may also act on this grid and influence therapeutic efficacy. This concept is also promoted by or supported by St. George's muscle contraction model some more than 100 or 60 years ago, from 1956. St. George's said that relaxation, muscle relaxation, is an active and energy-consuming process, organized or powered by mitochondria, electrifying the water hydration shells around contractile muscle elements. And when this process is ended by death, for example in a rigor mortis, the muscle loses its ability to relax and it will contract permanently. Contraction utilizes the energy liberated from this organized water grid and hydration shells, and ATP is probably the trigger in it. And this process is orchestrated by fluorescent activity, and another example of this physiological phenomenon is in headache, when vasoconstriction may also be interpreted like an energetic failure. So initially there is vasodilation to improve blood flow to a certain local area of high energy demand, and later vasoconstriction may also develop when the vessel can no longer produce active energy consuming vasodilation. Based on these very short principles, we can review the CDR, that's the cell danger response within integrative systems. As I said previously, the working model behind is that fascia and mitochondria can work together as a unified platform for medicine. Mitochondria are the power sources of this fascia water hydration shell network, which is disrupted by trauma, toxins and thoughts, emotional trauma impacting this very water hydration shell network grid and collapse it, the matrix itself, and trapping the cells in permanently in the CDR, somewhere from in the inflammatory or proliferatory or integrative phase. This platform is modulated by both medicine drugs through the receptor interactions and plants via their biologically active molecules on the grid. We can utilize this principle in regenerative medicine as well, because these days regenerative medicine often faces failure following probably poorly primed and activated tissue injection of platelet-rich plasma or stem cells. The point here is to prime or reactivate or optimize cells and tissues before regenerative medical interventions by improving the mitochondrial function, inducing autophagy, which is digestion of inactive metabolites in tissues, improving the microcirculation, and reducing the blood stasis, the blood sludging, fibrosis, and biofilm barriers. These are the potential factors which may influence whether the process will go into regenerative process through regeneration or fibrosis. I'm not going into details. We can see that very briefly that local acid-base balance, bulk water and hydration shell ratio and interactions, as well as inactive metabolite accumulation, may also influence the process, as well as calcium signaling and gentle pulsation of calcium in and out of the cell may positively influence this hydration shell grid. However, when there is an uncontrolled flood of calcium into the cell, it may induce necroptosis or apoptosis, as it is very well known in biology. Fascia tension, cold temp, high noise ratio fascia may also cause problems and hinder regenerative medical interventions. So this inherent chaos needs to be stabilized and controlled first before doing a regenerative medical intervention. Usually cells of the recipient tissue are in various stages of the CDR, so ideally these cells should also be synchronized and brought in synchronicity in one of the advantageous stages of the CDR, probably proliferative phase. Vagal tone, which is also influenced by Western medicine, may be able to influence this process in a beneficial way, improving capillary blood flow and lymphatic flow, and pushing the body towards a less defensive and more open and regenerative phase. So this is the proposed mechanism behind theory, how to exit the CDR with herbs and laser. So there are different and various tastes described in traditional medical records. Bitter cold herbs and antibiotics, antipsychotics and pain medications may work as bitter, cold and anti-inflammatory agents, reducing the CDR phase 1 inflammatory phase. Pungent is the next one. A very good example is aspirin and other pungent agents, pungent herbs, which are used to dissolve blood sludging and restore the physiologic heat potential in the blood, therefore moving the blood and improving the microcirculation. Sweet herbs provide scaffolds for the newly synthesized extracellular matrix and regeneration. Salty herbs restores conductance via introducing sulfate groups attached to polysaccharide chains, and that way they can improve conductance. Which, for example, fucoidan and scrofularian imbalances may also work this way. Sour herbs, finally, they stabilize the water hydration shells. Example is schizandrin in traditional medicine and amitriptyline in Western medicine. Both act as a stabilizer. There are similarities in function and as well as in structure, which can be seen in the left upper corner of this diagram. So structure and functional similarity may coexist between the two molecules, schizandrin and amitriptyline. So what is the common language behind medical traditions? Previously in my lecture I talked about Guizitang and traditional Indian Ayurvedic herbal equivalents, which are built up according to or on the same clinical principle and platform, improving the microcirculation and zeta potential, improving the mitochondrial activation, inducing the parasympathetic tone to promote and facilitate regenerative medical processes, and improving field coherence and convergence and dampness biofilm resolution. Here are some plant equivalents in traditional Chinese medicine and Ayurveda. There are dozens and hundreds of them. These are one-to-one equivalents, and there are potentially more functional equivalents as well, which means that one particular herb is used in China for one reason, and Ayurvedic medical traditions use a similar herb, not the same but a similar herb for the same function on the southern side of the Himalaya. So how can we implement all these principles in everyday clinical practice? There is a daily rhythm to be restored with minimum functional units to avoid polypharmacy. So in the morning we can give dulaxerin analogues, for example, mitochondrial stimulants to help and facilitate energy generation. The Chinese call them spleen qi and kidney qi, basically, and yang. They do nothing more than stimulate normal energy generation via the mitochondria, inducing autophagy and moving the blood in a sludged static microcirculation. During the day, we can give some titratable mitochondrial support in the form of ginger, cinnamon and fenugreek tea, helping mitochondrial function, and this is probably very similar to the steroid analog we give in Western medicine. In the evening, we are trying to settle, close and contain with herbs providing scaffold to the formation of water hydration showers. The Chinese call them yin tonification and mind stabilization. That's different. But basically yin stabilization, which is the analog of amitriptyline in Western medicine. Amitriptyline basically cools these pathological oscillations in neuropathic pain and central sensitization, and it doesn't provide scaffolding, it just provides stability and absorbs pathological oscillations in order to induce some sort of sleep in the patient. So we can see a multi-scale integrative systems architecture here, with Western medicine being highly effective on the short term, with unfortunately some potential side effects as well. Ayurveda is probably the cheap and long-term solution of our problem, with fewer herbs and daily rhythm, while traditional Chinese medicine is probably the more expensive and using complex formulas, so it is good for short-term symptom control and fine-tuning while the patient stabilizes, and after that we can possibly combine this with Ayurvedic herbs to improve efficacy and reduce cost on the long term. Integrative medicine does or operates on these principles because we want to balance side effects and enhance therapeutic effects. Good examples are, for example, ginger, cinnamon and fenugreek tea, which is used to warm the peripheral circulation in a patient with rheumatoid arthritis on methotrexate. I had a patient who had very poor response to methotrexate because her blood became sludged and static. It means that the red blood cells clump together, which impaired the microcirculation. So these red blood cell rouleaux couldn't pass and squeeze through the microcirculation. And by giving ginger, cinnamon and fenugreek tea, the patient's hands warmed up. She was able to better move her fingers with the methotrexate and the tea administration, because this tea was very likely to improve and restore and enhance the microcirculation as well as the drug delivery in the patient's hands. So the bottom line was improved functional outcome, and it was noticeable that the patient reported better circulation in her hands, better movement and warm peripheries, as well as warm circulation and warm digestion in the gastrointestinal system. All of these are basically manifestations of the same damp cold syndrome in traditional medical schools, which means that we can help methotrexate delivery with these simple methods. Another example is the administration or the co-administration of asparagus, astragalus and noradisтерone in fibroid treatment, because noradisтерone is very good and effective in reducing or stopping the bleeding secondary to progesterone insufficiency and estrogen dominance. However, it is not devoid of side effects, so potential side effects may come up. For example, acid reflux and amenorrhea. So after stopping this noradisтерone treatment, once the menstrual bleeding reduced or stopped, the patient may be converted to asparagus and astragalus combination. So the point here is that asparagus can provide scaffold for dehydration cells in the tissues and may improve tissue hormonal responsiveness. So the remaining endogenous progesterone may be able to exert a better clinical effect. Astragalus in the morning was also used to help mitochondrial function, and its polysaccharides may also help structuring the hydration cells in the intracellular as well as the extracellular matrix, improving the mitochondrial proton gradient and the mitochondrial function, while asparagus managed to help containing the fluids and organizing the hydration cells, which became injured and damaged in a prolonged yin deficiency or tissue unresponsiveness and damaged hydration cells. We went around in the UAE, Dubai, to find cheap and affordable plant sources, and unfortunately it was not easy because here the system works differently. Chinese medicine is very expensive here, and more than 5 times the price of the UK supply, and Ayurveda is the poor man's alternative medicine here. So I went around and explored potential Ayurvedic and Chinese medical plant equivalents. We will see it on the next slide. Here is the slide. So we can see a very interesting formulation, because this herbal formula may work as a plant-based antibiotic treatment modality, similar to Xian Fang Huo Ming Yin in Chinese medicine. So this is basically a functional similarity in principle with Xian Fang Huo Ming Yin, and several herbs overlapping with traditional Chinese medical pharmacopoeia. This can be used as a potential means to reduce antibiotic resistance and reinforce antibiotic stewardship on the long term. This is completely free to get, basically over-the-counter antibiotic, and it has the same working principle as the Chinese one, the Chinese counterpart, improving the blood circulation, reducing the blood sludging, and improving the mitochondrial function, as well as restructuring the hydration cells and stopping the sterile inflammation. So how can this relate to pain medicine again? So instead of targeting the nerves, the sensory nerves, which is the common and widely accepted practice in Western medicine, we are targeting the fascia, where nerves originate from. And I'm not going into details because this is complex quantum biology, the function of the Josephson junction and other structures, but suffice to say that targeting the nerves with, not the nerves, but the fascia, the disorganized, decoherent, chaotic fascia with herbs and plant may help pain beside Western medications by improving tissue responsiveness to receptor stimulation. So here we can see the model as a fascia, as a pain oscillator. We can see that there are various pathological conditions of this very fine microtubular and matrix fascia network powered by the mitochondria. It can be either cold or warm, excessively warm, or damaged by dryness or dampness, which is basically accumulation of inactive metabolites, or high bulk water grid or water hydration shell ratio, for example. So and the system can spontaneously settle into one of the attractor basins. We can see on the left side a blurred attractor basin, which is blurred by cold or dampness, inactive metabolites, and in the middle we can see this clear attractor basin, a normal and nicely organized pattern. And on the right side we can see this dry and arid attractor basin. So these pictures have been inspired by Professor Sheldrake, and who gave his kind permission to use them, and these are used for illustrative purposes only, and there is no claim towards his theories and my or our theories at all. There may be incidental overlapping between the two systems, which need further research to clarify the parallels and similarities between the two systems. We can see this mechanism working again in headaches, and the point here is that there are 4 ganglia in the head, namely the ciliary ganglion, the sphenopalatine ganglion, the submandibular ganglion, and the otic ganglion. So they are situated in bony sequesters, embedded in rich fascia connective tissue structures, and they are basically used as sentinels only, monitoring the fascia condition around them. So when the fascia becomes tight or dry or overloaded with sensations, or becomes undercharged whatsoever, the surrounding or the nearby ganglion can sense the changes and may try to induce a parasympathetic tone, for example, to discharge these pathological oscillations which may overwhelm the system. And so the flush, the discharge mechanism may come through lacrimation, tearing, nasal discharge, ear discharge, and the system can return back to its normal physiological state. However, when there are confounding factors impairing this discharge or flushing process, the pain signal may get trapped inside the body and cause various pathological oscillations seen in CRPS and cluster headaches. And the other one, when there is a successful discharge, the system may discharge pathological oscillations relatively quickly, causing the well-known pathological states of trigeminal autonomic cephalalgias, or including Suna and Sunkt headaches. So how can we balance the receptor theory and hydration shell dynamics under one roof? We can see on the left side various serotonin agonists such as triptans, ditans and ondansetron, and other medications which may influence the system such as SNRIs and tricyclic antidepressants, but mostly here SNRIs. So what's the point here? The point here is that these serotonin medications, agonists, usually influence the tone of the nerve fascia and vessel complex as a functional unit, and embryological developmental unit. Once the tissue breaks down and mitochondrial function declines and the water grid gets fragmented, these drugs may not be able to work efficiently anymore, and this is when plants may come in and help restore tissue responsiveness. And this is what we do via mitochondrial stimulation and hydration shell restoration and dampness digestion, namely biofilm or inactive metabolite breakdown and digestion. So the bottom line here is to restore tissue responsiveness with plants and leisure, and in order to improve Western drug efficacy and reduce their side effects. This is another picture of the same working mechanism. So on the left side we can see decoherence, inflammation, high noise to signal ratio, which is pathological when the system is no longer able to handle pathological excessive oscillations, which we call pain. On the right side we can see the healthy state with coherence, strong mitochondria and stable, continuous, very responsive hydration shells. And our aim is to restore the system's function and condition from decoherence to coherence. This is the last diagram showing the interchangeability between the traditional Chinese medical and Ayurveda systems and functions. We can see boxes here, and in the middle there are solid organs and organ systems, and on the side we can see, on either side we can see hollow visceral organs which may conduct signal in and out of the body and handle excessive pain oscillatory signals accordingly. We can see the interpretation of this whole system on the human body in the form of an embodied hydraulic computer here, where the meridians can be seen as wires. Signal is the phase transition, water phase transition between bulk and structured hydration shells as 0 and 1 binary phase signals. The processor is the mitochondria, and we can see some resistance in the form of cold, dryness and tightness, dampness, which need to be cleared up and optimized before a regenerative medical intervention. This is the computation logic inside the body. We can see parallel computation in every tissues, phase transitions, and distributed micro interfaces such as the membranes, the gels and the fascia planes, and we can see channels working to a certain level. However, beyond that, only charge separation and water protein interface changes may be able to conduct signals and changes. this is basically a fast switching system via phase state transitions, as I talked about it previously. Thank you for your attention, and I hope you liked it. If you want to collaborate or perhaps exchange ideas, please reach out and contact us via our website. Thank you.